In this recording, we're going to go over the exercise prescription lab for KNHES 5500. So this figure right here gives us the 3 information gathering items that will help us as experts to create a good exercise prescription for our client. And in essence, an exercise prescription is a list or group of exercises that we will give to our client in order for them to reach their exercise or fitness goals. And these prescriptions are aimed to be very specific, meaning we give them the specific exercises or movements that we want them to do with sets, reps, weights, all kinds of stuff like that. So the first thing that we'll go over here is the medical history. This is step 1 to exercise testing and prescription. This is important because we need to know of any past, present, and future risk of cardiometabolic and musculoskeletal diseases or injuries in order to make sure that our client is safe when they're doing the exercises that we have them do, and it helps limit our liability a little bit. There are specific guidelines that the ACSM has put out, or American College of Sports Medicine, regarding exercise prescription for various disease states like diabetes, cardiovascular disease, cancer, X, Y, and Z, you name it. If you are interested in those, or you know that you want to work with that population in the future, let your TAs know, and we can definitely give you some resources to help you make a prescription for somebody that has a disease like that. All right, the second thing here is the comprehensive fitness test. So this gives baseline fitness levels and highlights areas of strengths and weaknesses to target in our exercise prescription for our client. The key components of this test is body composition, cardiorespiratory fitness, flexibility, and muscular strength and endurance. And these are all of the same tests that we have done previously this semester in lab. Lastly, here we have the fitness needs assessment. So traditionally, this is done via like a paper questionnaire. Maybe it's online using some sort of software like that. But it's important that we get to know our client and get to know exactly what they want in their prescription. After all, this prescription is for them. It's not for us as the practitioners. We want to give them exercises so that they can stick with it behaviorally, so that they come back into the gym and they continue with those healthy behaviors. Some important points for a fitness needs assessment is we want to know how active our client currently is and what activity they currently participate in, if any at all. And then what's especially important is we want to know what they want in their prescription. The last thing we want to do is give them something or exercises that they hate doing and they never come back into the gym. That's a giant waste of their time and our time. A lot of times these needs assessments are not always comprehensive. So you may need to talk to your client to get a better idea of what they want. And again, that's important to build a rapport with them. So when we're making an exercise prescription, sometimes it's a little fuzzy on where do we start with it. So the first thing that we like to do is consider our client. So these are the things we just talked about. Look at their medical history, their fitness test results, and their needs assessment. Then we'll go ahead and consult the guidelines. So the American College of Sports Medicine, or ACSM, has guidelines for healthy adults for cardiovascular, strength/resistance exercise, and flexibility. We'll go over these guidelines in the next couple slides. Again, if you're interested in more clinical populations and exercise prescription, let us know and we can give you those resources. So before we get into the recommendations, all of these guidelines that we'll talk about over the next couple slides are broken down into the FIT VP principle. So basically FIT VP stands for frequency, intensity, time, type, and then volume and progression. So this first table here are the aerobic exercise recommendations from ACSM. You can see on the left-hand side here, it's broken down into that FIT principle. Go ahead and pause the video here and read through these guidelines. An important note to make is the volume, or how we volumize aerobic exercise. And so volume for aerobic exercise is a product of frequency, intensity, and time. So you can literally multiply the frequency of aerobic exercise by the intensity by the time, and you can get a volume of it. Progression depends on health status, fitness, training responses, and goals. ACSM recommends to start low and slow, and that's especially important for people who are new to exercise or getting back into it. And the ACSM recommends an increase in exercise time/duration per session of 5 to 10 minutes every 1 to 2 weeks over the first 4 to 6 weeks of an exercise training program. They say that this is reasonable for the average adult. That was a lot of numbers, a lot of words, so I'm going to go ahead and read it one more time. The ACSM recommends an increase in exercise time or duration per session of 5 to 10 minutes every 1 to 2 weeks over the first 4 to 6 weeks of an exercise training program. Now we'll move into resistance training exercise recommendations. Again, you can see on the left-hand side, this is broken down into the FIT principle. This time they left off time because it's kind of muddy when we talk about resistance training and time. Go ahead and pause the video here, read through these recommendations and get a good feel for them. Some important notes for resistance training recommendations is that frequency will be different depending on individual goals, whether your client is looking for gains in strength, hypertrophy, power, or endurance. Another note to make is that more advanced individuals may enjoy upper, lower, or push-pull split routines as opposed to full body routines. Another note here is that rest intervals, ACSM says that 1 to 2 minutes is sufficient and time efficient in terms of rest intervals between sets. They do note that longer rest periods may allow for a greater amount of work to be done. So speaking of a greater amount of work to be done, an important question is how do we volumize resistance training? So volume is defined as the total amount of sets performed for a given muscle group or movement pattern per week. When we talk about progression with resistance exercise, we know that for continual adaptations to an exercise program to occur, muscles need consistent increases in muscular stimuli. Basically, this means that if you don't increase the demand on the muscle, you will not see any fitness improvements beyond what you've already achieved. And this is termed the overload principle. Last table here are the flexibility exercise recommendations. Again, these are broken down into the FIT principle. Go ahead and pause the video here, read through these recommendations. An important note here is in the type of flexibility exercises that are here. There's so many. Go ahead and give these a quick Google search and you can kind of see how they differentiate from one another and why you might use them for some clients over others. All right, so the entire goal of this presentation and this lab is to use the data that you're given or that your TAs will give you and the guidelines that we just went over, and you will be making an exercise prescription. We'll go over a sample exercise prescription on the next slide here, and make sure you're referring to the Carmen page. We will put up a template for you to use for this lab specifically. So this is an example exercise prescription. The first note that I will make is that this is for a moderately active client, somebody who is already established with resistance exercise. This is not a newbie. And this exercise prescription is broken down into 1 full body day, 1 upper split, and 1 lower split, okay? So I have every single day of the week here and kind of a brief description of what the day is in this second row here. And in the third row across the week, I have specific exercises that this person will be doing each day. An important note is that this exercise prescription is not 100% complete. If I gave this to a client, they would have no idea what weight to use. We can use the data from their exercise test to give them a goal weight to use for this exercise. So let me make that a little bit more clear. On these strength days or mixed days right here, so on this example, it's Monday, Thursday, and Friday, my client would have no idea how much weight they're supposed to use on the incline chest press. Same with all of these exercises here, all of them here, and all of them here. So we can use the data from their comprehensive fitness test and give them a sort of goal weight to use here. And you can refer back to the tables of, let me scroll here. You can refer back to this intensity portion of the table right here to work through those. So a couple more questions to consider as we're putting an exercise prescription together. First one here is, does your client know how to do the exercises you included in their program? If they don't, maybe you should show them how to do it. Maybe you should give them a link to a good video that shows them how to do it. Make sure that they have some sort of trainer or exercise physiologist on hand to show them or correct their form, just for safety reasons. Another question to consider is, does your client need a warm-up or cool down phase in their workout? Are we just going to put them right onto a back squat, or will we have them stretch, warm up a little bit? And lastly here, how should your client progress after week 1 or maybe after week 4? What do those transition periods look like? How are we changing the intensity? Are we changing up any of the specific exercises that they're doing? So these are just some of the final questions to consider as you're putting an exercise prescription together. If you guys have any questions during your lab as you're completing your exercise prescription, please reach out to your TAs.